addiction and depression, which one is the cause and which one is the effect?
As
Can you add the question?
yes, sir. Internet addiction or depression, which one comes first? As I had already explained, this is a chicken egg dilemma. Whether these depression, anxiety and stress are leading to internet addiction, or the individual has got internet addiction and then he is driven towards depression, that is still not clear. So that needs to be sorted out.
How would you propose a prospective study as you discussed?
How would you propose a prospective study?
So I would like to screen the patients for internet addiction first and then follow them over a period of time like an year or so to see that whether they manifest depression, anxiety and stress. So that would be better. Also, individuals who are already suffering from depression or substance abuse or ADHD or any other disorder, they can be screened on a longer time to see whether they manifest internet addiction after that or not. So that is how a prospective study can be done to see and establish the causal relationship between the two.
My name is Burgis Kurian. I just want to ask you a question.
उधर जाके खड़ा होकर माइक सामने है अच्छा चल रहा है
My name is Burgis Kurian. I'd just like to ask you a question. You certainly looked at anxiety, depression, and something else you said.
Depression, anxiety and stress scale.
Yeah. Did you look at the concept of alexithymia in relation to these students?
No sir, that was something beyond the scope of my study, so I did not take it.
Why is that? Why did you think it was beyond the scope of your study?
So for the fact that this is an exploratory study and first of its kind in India to be recruiting such a large sample, I had to restrict myself to certain variables. So that is how, according to my aim, I was proceeding and I just screened the patients for depression, anxiety and stress and not for alexithymia.
Well, since you looked at depression, it would have been very interesting to see whether these children are growing up with some elements of what is known as alexithymia, because they are loners. They don't mix very much, and it has relevance with various other childhood and adolescent psychiatric labels. The next question I want to ask you is, you have done a wonderful job.
Thank you, sir.
And this is something of concern to families right across the world, not only the so-called developed world, but India and China. Even though they are not included formally, but they are also developed countries, and the parents are concerned. What is the public, or shall I say, social application of what you have done? You did mention that there must be other prospective studies, but you got enough information now that there is a correlation between what you consider as internet addiction and a social problem. How will you use this as a social application in the present context?
Yeah. As I have already mentioned in the clinical implications, as far as youth is concerned, if a boy comes to you with depression, anxiety or stress, then it has to be in the mind that he could be addicted to the internet. So that is how this study has to be applied in present context, that internet addiction could be masquerading as these psychological disorders and you may be just concentrating on the psychological disorders. So instead of that, the internet addiction has to be treated. So that's how it has to be applied socially presently.
No more question for this paper. Once again, I request the question must be on the basis of the what he has done. No suggestion, no other things, because it is a award paper.